The excitement that set in after discovering pregnancy test results shows two lines, and you wake up one morning to see bleeding, and that excitement will be replaced with immediate panic and worry. Am I having miscarriage? Why am I bleeding? Am I losing my baby? Is it normal to be bleeding during pregnancy? What is happening? If you ever experience this or you worried about bleeding during pregnancy, this video is for you. 20 to 25% of women experience bleeding or spotting during pregnancy, especially the first trimester, and this can bring a lot of questions on people's mind. Is it normal to be bleeding during pregnancy? And that is why in this video to clear it up. In this video, in this particular channel, we are about sharing health education to others, women to understand themselves and act better when they have health issues, so that they will not be masking symptoms, so that you can start treating your health issue as a woman from the root cause and start from understanding yourself as a woman through videos like this. If this resonates with you and you love yourself as a woman, you love to take care of yourself and understand yourself as a woman, make sure you like this video, watch to the end, and also subscribe for more health about women, for more health content about women like this. So let's go ahead with this video. First, let's clear something very important, which is your menstrual period. Your menstrual period is the shedding of the uterine lining when there is no fertilization, and this happens after successful ovulation and production of egg, and there is no fertilization, no pregnancy takes place. And when it's that time of the month, it starts shedding as your menstrual cycle, and this is different from what you experience during pregnancy. And this one actually happened because the uterine wall thickened, waiting for fertilization to take place. And when it did take place, it shed as menstrual cycle life, right? But during pregnancy, when you are pregnant, the fertilized egg, which is now a zygote, will have to attach itself to the house which is around the uterine lining. So during this period, there will be changes in hormone, and there's a part of that uterine lining that is thickened, and this can come out in form of light spotting, and this is called implantation bleeding. It's not a true menstrual period, and this is usually light in color and for a very short period of time. It's not the same as menstrual cycle. It's called implantation bleeding. Aside implantation bleeding, there are other causes that can result to light spotting or bleeding during the first trimester of pregnancy. And this can also be caused by hormonal changes, because during this time your system is still trying to adjust to the new development, which is fertilization and the new zygote attached to the uterus. So there could be fluctuation in hormones like progesterone and estrogen, and this can result into light spotting. It usually happens in first trimester. Secondly, is sensitivity of your cervix. So there are changes in the cervix because there is increase in blood flow around the cervix, so it makes it very sensitive. So at times, if you go for medical examination or you insert something that irritates your cervix area, it can result into light spotting. And the other one is infection. If you have an infection because of the sensitivity of that area now, you can also experience it. All these are signs of communication to you that something is happening, that you need an evaluation immediately. Now this is very important because some bleeding can be associated with miscarriage. It can be any kind of miscarriage. It could be threatened miscarriage, incomplete miscarriage, or complete miscarriage. It could be an ectopic pregnancy where the zygote or the developed zygote, which is the fertilized egg, attach itself around the fallopian tube instead of the uterus, and the fallopian tube is not capable of housing a growing baby. So it could be a sign of ectopic pregnancy. But if you want to know more about the ectopic pregnancy, the signs and symptoms, what causes them, I'll be doing another separate video on that. Let me know in the comment section down below if you want me to do a video about it, ectopic pregnancy. It will also be a threatened around the placenta, maybe placenta problem or infection, and this can come you experiencing heavy bleeding that looks like normal menstrual period, and you know this most of this be normal menstrual period during this time. It can also come with you seeing clots come with dizziness, feeling like fainting, you have cramp or pain around the abdominal area, all these are called for concern. There are signs you need medical intervention immediately, and you are not in the best position to say whether it's something to be worried about or something not to be worried about. You need medical intervention immediately. Our advice not to self-medicate, don't assume, don't ignore. While I also advise you not to panic, because if panicking will not help you, run to the hospital to see your healthcare provider for medical evaluation immediately, so that the right evaluation can be done and treatment can be done immediately to save you and your baby. If you have come to the end of this video, if you enjoyed this video, make sure you like, comment what do you benefit from this video, whether you have experienced spotting during pregnancy before and what did you do about it, so that others can learn from you as well. See you next week with another valuable pack video to help you live a healthy and better life. Make sure you subscribe so that you get notification when I post any video. Bye. See you.